Hello, Silke. You just came back from the Radioligand Therapy session, and I heard that you saw a very interesting abstract from the Canadian group.
Yes, so as I told you, I mean, it's a bit unfortunate because it was a bit hidden because like on the same time was the presidential symposium, but very interesting data from Kimchi, very well presented. Actually, I think really a question of a study that's a very important phase two study, academic study from the Canadians, asking the question if docetaxel or lutetium is more efficient after 1 RP in MCRPC. So really important question. And actually, the idea was that lutetium would win for RPFS. That was the primary endpoint. But in reality, there was no difference. And very interestingly, the OS was significantly better for the docetaxel group. This is, I think, quite surprising, interesting, and I think it will give really a lot of questions again for APCCC. The good thing is that actually our panelists had already that impression when we voted on that question 2024. So this, I think, is very interesting that even before this data came out, because this is really the first time I see this data, our panelists were already going in that direction. So yes, I think really interesting data. We have to understand better, but I guess yes, we will have a lot of discussion there. And the chemophobia, maybe we have to overcome it. It's not only the patients, it's also the doctors who have a lot of respect for docetaxel.
I agree. I think it will be very interesting to re-vote on these questions, knowing that maybe the treatment landscape will have changed in between, and we see what the outcome is in 2026.
Exactly.